If you have bad knees, the worst advice you can follow is no pain, no gain. I treat hundreds of patients for circulation issues, varicose veins, swelling, DVT. And when I ask about their history, I see a pattern. They had knee pain. They tried to push it through with different exercises. The pain got worse, so they stopped moving. And that is the trap. When your knees stop moving, your circulation stops flowing. Squats are great if your joints are of younger age. But once you go over 40 and your knees click, pop or ache, then squats might be destroying your mobility. I know I demonstrate and show and recommend squats to so many of you, and many of you have asked me about alternatives to squats that can help improve your circulation and help pump the blood back to your heart without grinding your knee joints. So today's video, I'll show these 5 exercises that help you build strong legs and pump blood back to your heart. Before we start, you need to understand the connection. Your calf and thigh muscles are the pumps that push the blood up. Your knee is the hinge. So if your hinge is painful, you stop using the pump. Today we are going to bypass the rusty hinge and target the pump directly. So exercise number 1 is seated leg extension. You can do this right now while watching this video. Sit tall, slowly extend one leg, squeeze the thigh muscle hard at the top for 2 seconds and lower slowly. Here we are activating the quadriceps, especially the VMO or vastus medialis obliquus muscle that stabilizes the knee. Number 2, shift the focus. Often knee pain isn't a knee problem, it's a lazy hip problem. And this exercise is the glute bridge. And I'm demonstrating how we do it. You lie down, keep your knees bent and lift your hips. When your hips are weak, the knees have to do double the amount of work. They weren't designed to do that. By strengthening your gluteal muscles or your hip muscles, you are essentially hiring a bodyguard for your knees. The hips take the load, so the knees don't have to. Now, number 3 is my favorite as a vascular surgeon, the standing calf raise. You can hold on to a chair for balance. Go up on your toes, pause and come down. Simple, isn't it? But medically, this is powerful. Your calf muscle is your second heart. Every time you lift your heel and raise your calf, you are actually squeezing the deep veins and helping the blood go back to your lungs and heart. If you have heavy legs, swelling or varicose veins, this isn't just an exercise, it is therapy. And I recommend it to almost all the patients that I examine. Exercise number 4, you should do it when your legs are stronger because we now need functional movement. But see how I'm doing it. I'm actually doing a lunge but stepping back and not forward. When you step forward into a lunge, your momentum can go directly at the knee. And if you're not too careful, you can end up hurting your knee. But when you step backward, your weight stays on your heel and then your hip. So it is biomechanically much friendlier to the knee joint. It builds balance and coordination, which is exactly what we lose as we age. And finally, number 5. For the days that your knee feels sensitive, the wall sit. Lean against a wall, slide down slightly so that the knee comes at a 90-degree angle and you don't need to go deep, just hold it at 90 degree. This is an isometric exercise. The muscle is working, circulation is flowing, but the joint is not grinding. And it's the safest way to build endurance into your quadriceps muscle without any wear and tear to the joints. Now here is the takeaway. I am not banning squats for everyone. But if squats hurt you, stopping them is not a weakness. It's an intelligent move that you take. Remember, pain is a stop sign. If you ignore it, you can crash. But you can take a detour and reach your destination. Strong legs and healthy veins. Try these exercises for 2 weeks and tell me in the comments if your knees and your energy levels feel different.